Welcome back to Search Ahead, a series of interviews with our colleagues in the field to learn firsthand about the situation in the respective countries. Today we will be talking to Dr. Karima Khalid. She is the treasurer of the Society of Anaesthesiologists in Tanzania. She's also working as an anesthesiologist herself at the Muhimbili Orthopaedic Institute. And at the same time, she's the lecturer at the Muhimbili University of Health and Allied Sciences. Good morning, Dr. Karima. It's a pleasure having you here. How are you?
Fine, thank you. How are you, Antonio?
I'm fine, thanks. I would like to start the interview with your current involvement in the Ministry of Health's Case Management Unit. You are actively helping with the training there. Could you just explain a little bit further about your role in this unit, please?
With the Ministry of Health and together with the other team members in the units and in collaboration with WHO and other partners, we are now conducting weekly trainings for providers in Tanzania, helping them, giving them information or training them on how to take care of these patients. And we focus mainly on the basics of care. So we believe that taking care of the basics will save many lives, other than focusing on more advanced care that we are not able to provide at a large scale in our country. As it is, we know that with the corona infection or the coronavirus, the COVID disease, 15% of patients need care, hospital care, and it's not the critical care, just oxygen and basic care in hospital. And we can save the lives of 15% of these patients who need hospitalized care. And only 5% of the patients will need more advanced critical care. We give the training via Zoom platform, and we have been very successful so far. A lot of participants have joined the Zoom sessions, the trainings, and we've had a very good feedback on the knowledge that you're providing to our people in taking care of these patients.
Thanks, Dr. Karima, for this explanation and for highlighting the relevance of training, especially during these times. And also regarding your role of training, it is the one at the university, teaching to the new generations of anesthesiologists. How is this pandemic affecting your work there?
Thank you so much for that question. Yes, I also train or I'm a lecturer at the university for both undergraduate and postgraduate residents who are taking anesthesia and critical care at the university. Currently, due to the COVID-19 infection or the pandemic, the universities have been closed. But we believe that all our residents who are already doctors are now back to their workstations, because normally when you're coming in to do your postgraduate studies, most of them are already employed in some areas. So once the universities were closed, the residents went back to their workstations. So we believe that from the knowledge that they have gained in anesthesia and critical care, they will be able, they're in a good position rather to help the patients who have contracted this infection. Because as we said in the first question, that we emphasize a lot on basics of critical care. So taking care of your airway, your breathing, your circulation, and these are the things that we always emphasize and teach to our residents and our students. So we believe that the knowledge that they have gained so far, whichever year of residency they are in, they will be able to use that information to help the patients in their work areas when they're back in their workstations. And not only the COVID-19 patients, but also the other patients who need the routine care that has to be provided, that is still going on for other patients, because we know that patients are also still getting sick from other diseases as usual, and they need surgery or they become critically ill because of other problems. So these people that we have trained are able to use their knowledge to assist or help provide care for these patients. And at the same time, they are still connected to us in one way or the other. So they're able to reach out to the university or to us, the lecturers, to gain assistance where they are stuck. And through the trainings that we're doing online via Zoom and other platforms, we're able to provide further doctors who are out there giving care to our patients.
Thanks, Dr. Karima, for your response. It is very positive to hear how the university has found the mechanisms to carry on assisting their students, although the disrupted times we are dealing with. Also, in the line of questioning related to training, you were involved in designing the SURG-Africa training for anesthesia providers at district hospitals in Tanzania. Do you think that the in-service training provided to your colleagues has helped them anyhow in the readiness towards this crisis?
Thank you so much. Yes, I definitely believe that the trainings that we provided during the SURG-Africa mentorship and coaching are going to be very useful, or have been helpful to our colleagues who are out there practicing. Because the main thing that we always emphasize on is readiness, being ready for for anything that is going to face you. Being ready for any emergencies that one is going to be faced with under any circumstances. So readiness is one of the key things that we teach in anesthesia and critical care, and it's helpful in any platform. And the other thing that we always emphasize on is teamwork and with leadership. So you have to have somebody who's leading, you need to have a team, but also you have to have somebody who's leading that team and making the right decisions. So we always believe that in medicine there is no heroes, and there's always people working together to come up with good results. So this is another thing that we always tell our people to be ready with. So vigilance is also another thing that we always emphasize on, being around, being there, making sure you're alert, you're seeing what the patient is going through, and that way you're able to pick any problems quickly and take care of them and respond correctly.
Thanks, Dr. Karima, for illustrating the benefits of including anesthesia in the project. I would like to finish the interview in a more personal note regarding your PhD in essential critical care for mothers and newborns. How is this pandemic affecting the mothers, the new mothers and their babies?
Thank you so much. Yes, I'm pursuing a PhD on essential critical care for mothers and newborns in Tanzania. And interestingly, the things that we are trying to focus on in my PhD are the same basic things that we are trying to also emphasize on or advise on when it comes to the care of the COVID-19 patients. It's all about the basics. It's all going back to the ABCs of care of patients. Making sure that the basics are in place with people who are well trained to take care of this basic care of these patients. So my PhD has been somehow very much linked to the care of patients of the COVID-19. Mothers, on the other hand, equally affected by COVID-19 as any other patient will be. And, but we have to know that a mother is carrying a baby, so we're talking about 2 lives at risk. So we always advise them to be more vigilant, to protect themselves and stay away from sick people and, make sure that they're well protected. I am able to use the knowledge that I've been trying to pass on through my PhD work, use the same knowledge to help, the patients who are affected, or to help colleagues who are dealing with patients affected by the COVID-19 pandemic in other areas.
This is all from us, Dr. Karima. It has been a pleasure talking to you. I wish you all the best. I hope this situation ends soon and well. And thank you for your time.
I hope this information will be very helpful to the program and to my country and to the whole world at large. And I'd like everybody to stay safe and stay and protect each other from the infection. And hopefully we pray that and hope that this ends as quickly as possible and that we can be able to go back to our normal lives as soon as possible.
Hopefully. And that is all as well for everyone. Remember that you can just access to our other interviews in our YouTube channel. Thanks for watching this one with Dr. Karima. And keep in touch with our latest news, following our social media and checking on our website. Take care and keep yourselves safe.